Hi, I'm Heather Thompson, Editor-in-Chief of MD&DI, and I'm here at MD&M East with Qualcomm Life's Rick Valencia. Hi, Rick.
Hi, Heather. How are you today?
I'm good, thanks. So I had some questions for you. You just gave the keynote.
Yes.
My first question is, you talked a little bit about the Tricorder device, the Qualcomm X Prize.
Right.
How close is Scanadu? Because they just released Scout.
How close are they to creating the Tricorder?
And winning the X Prize.
Oh, and winning the X Prize. Well, I don't think I can go that far in telling you how any one of the competitors are doing, but Scanadu was one of the early companies that embraced the X Prize, and they built their business and acquired their initial funding around the idea of competing for the $10 million X Prize. So they're a really exciting company that's developing a very exciting product that we expect to be one of the top competitors. Let's just say that.
Are there some other contenders that we may not have noticed?
You know, there's no one really, other than Scanadu, that's been overly public about the product, at least. There's a number of people. Maybe you heard of Jack Andraka, the teenage boy wonder who created the diagnostic for cancer of some sort. I can't remember exactly which cancer, but he crowdsourced the solution, and he and a group of young high school kids have also opted in. So there's a number of, I think I mentioned there's over 275 entities now that have opted in, and that's in 35 different countries. And we'll, in the next probably 2 or 3 months, we'll start to hear a lot more about the specific products and the teams that are going to be probably grouping together to compete for the prize.
Great, thank you. I think Qualcomm Life's key platform is really the 2net, and you demonstrated it here today. What are some of the key challenges that you're seeing with adoption of the 2net, particularly in hospitals?
Well, 2net is primarily designed to be a solution used outside of hospitals and doctors' offices, mostly in a home environment. The challenges are many, and it really revolves more around just adopting change within the healthcare system in general. Mm-hmm. The technology is pretty slick. It works pretty well. We can very quickly get a device integrated. We even have an open API and an SDK, so our customers can go do that integration on their own if they'd like to. And so the technology, really there aren't a whole lot of challenges there. I think it's really around the change that's going on in healthcare right now through the Affordable Care Act, causing caregivers to be required to care for patients across the continuum, including once they're discharged or they leave the doctor's office, meaning in a home setting. So having this real-time data, this trending information is becoming more and more important. But everyone right now is building those solutions. So it's still very early, but we're going to see some really exciting things over the next year. So we have a number of really exciting solutions that we're working on with some of the world's biggest healthcare companies that you'll be hearing about within the next 6 months to a year.
We don't get a sneak peek?
I'll give you kind of a hint in directions, but I can't tell you specifics. But we have some really interesting pharmaceutical solutions. So pharma companies that really care these days about how well their drugs work in the real world, as opposed to just selling more of them, are deploying new solutions that combine sensors and also to create a solution around medication adherence. We're also seeing some really interesting things in clinical trials. Think of the challenges around clinical trials, the time that it takes, the cost associated, the inconvenience for patients. When you can capture data remotely and get it back to a clinic on a real-time basis where it's actual data coming directly from a medical device, not a person trying to remember what it was or writing it down or putting it into another database, and also that patient not having to go into the clinic in order to get the data in the system. That really provides a lot of opportunity to move these clinical trials faster and create drugs faster. And so we have a lot of really interesting things around clinical trials as well.
That's fantastic, especially since FDA is going to be really cracking down on preclinical market data and post-clinical data. So that really opens up a world of possibilities. Right. Yeah, that's fantastic. So speaking of FDA, and you might be the best person to ask about this, last week they announced that they were going to be looking at medical device applications specifically for cybersecurity. And how critical is cybersecurity in medical devices? Is FDA posturing, or is there some real challenges with cybersecurity?
Well, there are always challenges with security once you digitize data and you put it into networks, but that security is very manageable. You have to take it seriously. You have to abide by the laws of the land, which, by the way, are different all around the world, and we're learning the hard way just what it takes to deploy these types of solutions in different parts of the world. You have to have end-to-end encryption. You have to have data centers that are developed with security and privacy in mind. And but it is a manageable thing. I mean, it wasn't that long ago where we had to go into a bank and wait in line to withdraw or deposit money. Now I can take a picture of my check sitting right here and have it show up in my account instantaneously. And that's information that needs to stay pretty secure. And we figured out how to do it for the most part in the financial services realm. So I think we'll figure it out in healthcare as well.
Just a quick follow-up. Do you think FDA has the infrastructure in place to assess cybersecurity?
I don't think the FDA currently has the infrastructure in place to deal with what it needs to deal with in digital health in general. But I think it's very mindful of the challenges that are in front of it and also the opportunity that digital health presents. So I think they will address that. And I think so far the FDA has shown, I think, a positive approach and a good spirit about addressing regulation in the wireless health realm with regard to devices, applications, and the communications technology. A lot of still open questions, and we're really not sure where things are headed for certain quite yet. But again, it seems like they're taking the right approach.
Great. Thank you so much, Rick. I appreciate your time.
Thanks, Heather.
All right.